My pleasure and great privilege to introduce our speaker today. In addition to being a valued colleague, I consider Tamara a good friend. We have served on the Georgia SOFI board together for approximately 5 years, where she just finished. She is two past presidents of our organization, and she's currently serves on the board of trustees for National SOFI. In addition to what her day job is, I'll tell you a little bit about that in just a second. Tamara is first and foremost a public health professional, consultant, and advocate who focuses on improving the health in marginalized communities. In her day job, Tamara is the director of Maternal and Child Health Collective Impact for the March of Dimes here in Georgia. And in addition to that, she does own her own consulting company, both as founder and principal equity consultant, where she approaches public health issues, mostly related to maternal and child health, but others as well through the health equity and social justice lens. So I will turn it over to Tamara, and she can tell you more about it.
Thank you, Joanne, Dr. Chopak-Foss, since we are in the official professional setting. I always appreciate speaking to fellow public health colleagues. And as Dr. Chopak-Foss said, we know each other from the Georgia Society of Public Health Education and have also become friends. Again, Tamara Mason, as you all heard in my introduction, I love introductions, right? It makes you feel like so fancy and you're like, who is that person? But I do all the things. So I work for March of Dimes, as said in the introduction, as a director of Maternal and Child Health Collective Impact. And I will tell you about my work with the March of Dimes, particularly related to doulas. I am also an entrepreneur, as you heard, and I'm also a doula. But probably most importantly, I'm a mom of two awesome kids, an 11-year-old Du Bois. So he has huge shoes to fill. He's named after W.E.B. Du Bois. And Chloe Soleil, who's 9, and she's a true ruler of the house. And they are actually on midwinter break. I'm being a bad parent. They are upstairs on their devices so that I can do this presentation. So while we wait for the slides to come up, I'll tell you about what I wanted to talk about today. So wanted to talk about just in general, which many of you may be familiar with, the Black maternal health crisis here in the country, and just in general, honestly, the maternal health crisis, but how it is disproportionately impacting our Black and Brown communities. I wanted to speak with you a little bit about the history of OBGYN in this country, because I do think that it's related to the disparities that we see. I also wanted to provide a little background about the history of midwives, particularly Black midwives, and how up until about the 1900s, they were present at 50% of the births in this country, and through systemic racism and very targeted policies, they have been phased out. And then I wanted to transition into doulas and the importance of doulas. I think they are a solution to the maternal health crisis that we're having in this country, and wanted to share with you March of Dimes' stance on doulas, and then some just awesome work here in the state of Georgia that you may not be aware of regarding doulas. So you all heard my introduction. So I think where I'm going to start with is, honestly, in most of my presentations, I usually start with the concept of health equity, and knowing that, you know, many of us probably are aware of what that is, but just making sure that we're all on the same page. I've been doing that lately. So, and I have a great graphic that hopefully eventually we can see. And it looks like something is happening. Okay, I'm gonna keep talking about health equity, and maybe once we get up, we'll be able to see one of my favorite graphics. So again, I know I may be preaching to the choir, but health equity, as we may know, is the attainment of the highest level of health for all people, where everyone has a fair and just opportunity to attain their optimal health. And more importantly, I think it's the absence of unfair, avoidable, or remedial differences that are based on groups of people, whether these groups are defined socially, economically, demographically, or by any other dimensions of inequality. I think something that's important about health equity, hopefully when we get the share up and you can see this graphic, particularly for us in the public health sphere and medical sphere, health equity has different components, right? So a lot of times we're talking about healthcare and access to healthcare, and that's very important. And then also a lot of times as public health practitioners, we're talking about health behaviors, folks' individual tobacco use, diet, and exercise. But healthcare and also health behaviors, that's only 50% of the health equity equation. The other 40% is essentially our social determinants of health, which I know that we're all starting to use that language and basically looking at the fact, right, that people do not live in a vacuum.
I'm sorry to
So,
interrupt. Ms.
yes,
Mason, could you try to share, please?
Yes.
absolutely. Okay. All right. I think we are in business. All right. Here we go from this current side. Okay. We're going to get ourselves together, you all. Okay. So this is a slide that I was on, and just on the bottom, we're talking about access to care, how that's only 20%. Our health behaviors, that's only 30%. But then look at the top, 40% are social determinants of health, SDOH, so our education, job status, income. And also, if you look all the way over to the right, it says that 50% of that can be traced back to your zip code. So I just think that that's something really important for us to consider as public health practitioners, and that we have to move out of the sphere of just thinking about access to care and addressing folks' individual behaviors. All right, and then I also like this slide because it talks about some differences between equity and equality. And so the main differences for me is that equity is essentially it's a process, first of all, and also it is not the same. So equity recognizes differences, whereas equality recognizes similarities. With equality, we give everyone the same. It doesn't matter what their starting point is, what their needs are, we're giving everyone the same across the board. Whereas equity recognizes the differences. People may need different resources, right, to get to where they need to go to achieve their optimal health. So this is a graphic that I really want us to see, and I've stole it from the Robert Wood Johnson Foundation. So you can feel free to use it as well. So again, if you look at the left, right, we have our three gentlemen. They're all trying to watch a baseball game, and their viewing of the baseball game is impacted by a fence. So if we give all three gentlemen, irrespective of their size, so giving the short gentleman, the middle-sized gentleman, and the tall gentleman, equity, right? Excuse me, equality, the same box, we see that we don't alleviate the issue. So the short guy, he still is not able to see over the fence at all, right? With that same size box, he's looking directly at the fence. The middle-sized guy, he's doing a little bit better, right? He's able to see a little bit over the fence with that same size box. And then the tall guy, right, he's doing great. He has an additional leg up on being able to like fully see the game. But then now when we look at doing things in an equity fashion, right, again, meeting people where we are, so we see that we give the short gentleman, because he is short, we give him two boxes. And that finally gets him to a place where he's able to see over the fence. The middle-sized gentleman, he just needs one box. So again, he's in a place where he's able to see over the fence. And the tall guy, we don't even give him a box at all, because he's able to, just standing on his own 2 feet, he's able to see over the fence, right? So again, equity, you customize, it recognizes differences, whereas equality, we give everybody the same. And remember, we want to achieve equity. So we have equality, equity, reality, right? When we think about our systems, our structure, systemic racism, usually what's happening is the marginalized, which in this case, the shortest person, he's down in a ditch, right? And then the middle-sized person, the middle class, perhaps, they have one box. And then the tall guy, right, the upper class, top 1%, he has like 6 boxes. And really what I hope to get to is all the way to the right of the slide is liberation, where we just remove the fence totally so that it's not even a barrier. It's not blocking people from achieving, their optimal health. So hopefully this graphic helps you when you're thinking about particularly the difference between equality and equity. And so let's talk a little bit about the state of maternal and infant health in the country, but also here in Georgia. So as many of you may know, the United States remains among one of the most dangerous developed nations for any woman to give birth, but again, particularly our Black and brown birthing people. So here in the United States, 2 women will die from pregnancy-related causes today. and every day. So that's happening every day. By the time we are finished with this webinar, 2 babies will have died. So 2 babies die every hour here in the US. Here in the United States, our pregnancy-related deaths have more than doubled over the past 30 years, whereas compared to similar industrialized countries, particularly in Europe, that's not happening, right? Their pregnancy-related deaths are declining. We also have a huge issue with access to care here in the United States. Over 2 million women live in maternity care deserts, which means there is not a hospital, at least within an hour of them, that offers obstetric care or no birth center or obstetric provider. And 7 million women of childbearing age live in counties that's either a full-blown maternity care desert, as I just defined, or with very limited access to maternity care. So again, also a huge problem in terms of access to care in our country. So then when we look at race and ethnicity, the stats are even more dire. So in general, the rate of preterm birth among Black women in the nation is about 50% higher than the rate of preterm birth among white or Hispanic women. Also, Black and American Indian and Alaska Native women are 2 to 3 times more likely to die from pregnancy-related complications. And again, this really is dependent on where you are in the country, right? So here in Georgia, Black women are almost 3 times more likely to die from pregnancy-related complications. But in New Jersey, I believe it's 7 to 8 times Black women are more likely to die from pregnancy-related complications as compared to Black women. And then our babies the same, unfortunately not doing well. So here in Georgia, our Black babies are 2 times more likely to die before their first birthday as compared to white babies. And then just in general, this is providing information about the number of women that die annually here in the United States. So in the United States, about 700 women die annually due to their pregnancy-related complications. And these deaths are anywhere from 60 to 80% preventable, depending on, what source you're looking at, whether it's the CDC or the Georgia Department of Public Health. So we really have a huge issue here in this country, and this Black and white disparity in maternal mortality. It's been continuing to increase since the 1990s. And this, we actually have a newer report card that was released in 2023, but unfortunately, honestly, it's the same. This one is about our 2022 March and Irons report card. So every year in November, annually, the March and Irons, we release a report card where we grade all 50 states and the District of Columbia and Puerto Rico on their maternal and child health indicators, particularly their preterm birth rate and also their infant mortality rate. So in 2022, and I'll be honest with you, also in 2023, our great state of Georgia, we received an F. We were at 11.9% for our preterm birth rate, and then our infant mortality rate is about 6.4%. So again, not doing well in general, but also when we look at the racial disparity. So in Georgia, the preterm birth rate among Black women is about 40% higher than the rate among all other women. So I don't know about you all, but I know when I was in school, if I was bringing home an F or a D, that was not going over well with Beverly Marie Armstrong. So we are not doing well here in the state of Georgia for any of our women, our birthing people, but again, particularly for our Black and brown women here in the state. So obviously at the March of Dimes, we don't believe that any of this should be happening. And our vision is we imagine a world where every mom and baby is healthy, regardless of wealth, race, gender, or geography. And in particular, our goals are to end preventable maternal death and risk, and also end preventable preterm birth and infant death. And we really feel to do that we have to close the health equity gap that I've been describing so that all moms can have a healthy pregnancy and deliver a strong, healthy baby at full term, which is 37 weeks of gestation. And so our approach at the March of Dimes, we are a national organization. Our headquarters are based in Arlington. We have a 3-pronged approach where we lead and innovate through research. We do direct service programs. We deliver direct impact through our mission. And then I actually did not know this about March of Dimes before working there. We also mobilize action through advocacy, both on the national level and the federal, on the national level and the state level, excuse me. So on the national level, we are a huge advocate of the Momnibus Act. And here in Georgia, we are very instrumental in advocating for postpartum Medicaid extension to 12 months, which was passed about 2 legislative sessions ago. So as I mentioned, March of Dimes is a national organization based in Arlington, but we are in essentially like 39 cities. We call them markets, 39 cities and states. And so we are here in Georgia on the March of Dimes, Georgia, Atlanta market. Our headquarters are based in Atlanta and Buckhead. I particularly focus on Atlanta, Fulton County. And when we are fully staffed, I have a cohort counterpart who she's a maternal and infant health director, and she focuses on the entire state of Georgia. Okay, we were going along smoothly. Here we go. All righty. So just wanted to provide that overview for you all. Again, some of you may be aware of it, but want us to all be on the same page. So I'm going to transition a little bit. I want to talk about very briefly the root causes of why, these disparities exist, but I'd like to hear from you. So if you have access to a smartphone, or you can also do it on your computer, we're going to go to something called menti.com. menti.com. And if you can, enter this code 43430133. And it's a very simple question. What do you think are the root causes of the Black maternal health crisis? So while I'm going over these two previous slides, you all can just be inputting your answer. It's free word. You can just write what you'd like to, and eventually it'll pop up as a word cloud, and hopefully I can share that. So lately, also in my presentations, I think it's very important for us as we talk about these disparities to think about and talk about the history of injustice on Black bodies. And so in particular, as many of you may know, Black women's bodies were used as breeding vessels to support the institution of slavery here in this country. But particular in terms of the OBGYN field, obstetrics and gynecology, excuse me, tongue twister today. J. Marion Sims, who essentially is considered the father of modern gynecology, and I appreciate that this is recently coming, to light, honestly, mainly through a lot of social media efforts. But he performed a lot of the essentially technologies that occur now in modern OBGYN on enslaved Black women without their permission and without anesthesia. And so this picture, which also has been circulating in the past couple of years on social media, is of Anarcha Westcott. She's a 17-year-old enslaved girl who she endured over 30 operations without anesthesia by James Marion Sims, as he essentially, quote unquote, figured out what was going on. So I think it's very important to note that this is a part of our history. It's a part of American history, but particularly the history of injustice on Black bodies. And then I did want to mention, as I mentioned earlier while we were waiting for the slides to come up, about Black midwives. And so in the US, a majority of births were attended by midwives, and particularly Black midwives from the mid-1900s. And so Black midwives were a very important part of the community for all. And so in addition to, being present at births, being in the community, they also served as spiritual healers, family counselors. They were breastfeeding consultants, nutritionists, helping families to think about when's the next time they want to start to conceive. And so we're really very integral in the births of many people in this country. And then very systematically within the early 1900s, this started to be taken away. So in particular, there was an act in 1921 called the Shepherdtown Act, where essentially it started to put practices where trying to remove lay people from the birthing field, putting quote unquote sanitary practices, and also starting to put in the popular consciousness that birthing at home and midwives were not sanitary. And then also in the 1940s, particularly the American Medical Association, really that push of bringing birth to the hospital setting. So that by the 1970s, essentially only 1% of births were being attended by midwives across the country, and most births, as we know now, occur in the hospital. So just a very systematic approach to remove Black women from this field that I think that we also have to consider as we talk about maternal and child health. All right, so how are we doing in terms of our root causes? I think I'm gonna stop sharing here and see if I can pull it up. All right, awesome. Okay, so we have 24 responses. We have lack of access to care, low health literacy, poor quality of care, no prenatal care, racism, low income, provider bias, hemorrhage, implicit bias, institutional racism, lack of education, historical racism, stress, preeclampsia, access to care, poor access to care. Awesome. Thank you so much for participating. And you all are pretty much spot on. I'm going to go back to the presentation. And so a lot of what you all mentioned, absolutely. So our inadequate access to quality healthcare, which we talked about just in general, that we really have the access issue in this country overall. In addition to the March of Dimes publishing our report card every November, this is not every year, but probably about within the past couple of years, we've also been publishing a maternity care desert report. And we did just publish one in 2023. So you can Google both like March of Dimes maternity care desert report to check those out. But I think it's interesting to know, particularly here in Georgia, almost half of our counties are considered maternity care deserts. So again, we know that access to care is a huge issue. Structural racism, we know, is an issue. Weathering stress of Black birthing people. There's starting to be studies about, the daily microaggressions that Black birthing people, Black people that we go through on a daily basis, that this impacts our overall health and livelihood, but it also impacts our birthing outcomes. Underlying chronic conditions, lack of respectful care, Black birthing people not being listened to during the birthing journey / pregnancy, and also implicit bias. Okay, so if you knew me personally, as Dr. Chopak-Foss knows, I am not a doom and gloom person. The stats, the data, it is very important, and we have to be rooted in that, but I am also a solution action oriented person. So thinking about everything that we just talked about, what can we do, right? How can we start to move towards achieving birth equity? And I do think one very impactful solution is the use of doulas for all communities, but particularly for Black birthing communities. And so before we get into that, just again, wanted to, set the stage, make sure we're all on the same page in terms of what is a doula. So doulas are trained professionals who provide physical, emotional, and informational support to a birth giver and also their partner before, during, and after childbirth to help achieve the healthiest, most satisfying experience possible. Doulas are not medical providers and cannot deliver babies or perform medical tasks. So doulas really have to be a part of the team, had to be integrated into the team, because we do need a provider, whether it is an OBGYN or a certified nurse midwife, to actually deliver the baby. As a doula, I'm also a certified labor doula. I cannot physically, medically deliver the baby. I'm there to provide support and to advocate for my client and her family, but I cannot physically deliver the baby. So we need our partners in the OBGYN field for that. As I mentioned, a doula is your advocate, your educator, and a support person. You will hear about this later. I'm a member of a doula agency here in Atlanta, and we like to say that doulas, we are your birth BFFs, your birth best friend. We provide physical comfort techniques, obviously during, the birth, but again, also emotional reassurance and encouragement, explanations about the labor process and the postpartum period, and assistance with breastfeeding. And what I like to tell my clients is that at the end of the day, I'm here to make sure that you have the birthing journey that you and your partner would like to have, which also is going to include both you and your baby being delivered safely. But the journey that you want to have, I'm here to support you so that you can have that journey. The benefits of a doula, and I'm so thankful that there's starting to be, evidence-based research on the benefits of a doula. In general, doulas make births go more smoothly. Doulas chance of having a C-section. Doulas also can lessen the duration of labor. Overall, women that tend to have a doula during their birth feel better about their birth and their birthing experience. And also women who tend to have a doula also are more likely to initiate and stick with breastfeeding. Importance of doula care. So March of Dimes in general, we think that increasing access to doula care is one tool to improve birth outcomes and reduce the high rates of mortality and morbidity among all women, but particularly among women of color. We think that we have to increase access to doulas by removing financial and cultural barriers. So we need more doulas from Black and Brown communities, and we need to remove the barriers of honestly, the training, the fees, the barriers. It costs money, right, to become certified as a doula. We also want to increase our doula training, support, and capacity development. And we also want to increase doulas from racially, ethnically, socioeconomically, and culturally diverse communities. So as I mentioned, right, doing all the things. So my day job is a director of the Maternal and Child Health Collective Impact here in Atlanta. And so I appreciate about March of Dimes that we realize large social scale problems such as reducing inequities in preterm birth, maternal mortality, and infant mortality, right? We cannot tackle this alone. And so we have to use a collective impact approach where we're engaging not only our maternal and child health stakeholders, but also our partners outside of the maternal and child health field, because as we know, pregnant people do not live in a vacuum, right? So if a woman is food insecure and she's pregnant, she's housing insecure and she's pregnant, she doesn't have enough childcare for her other children, all of that impacts her birthing journey and potentially her birthing outcomes. So we have to address our social determinants of health. And so with this collective impact approach that March of Dimes is using in 9 communities, including here in Atlanta, we're trying to reduce preterm birth and maternal mortality through a database approach, prioritizing communities, and also using a social justice and health equity lens. And one of the main hallmarks of a collective impact approach is that all of our different partners, we come to the table in this collaborative, we talk about challenges and solutions, and then we agree on a common agenda in terms of how we're going to reduce these inequities. So here in Atlanta, our common agenda, which we discussed and agreed and voted on almost 3 years ago now in July 2021, we said that our result that we're trying to achieve is that all Black mothers, parents, families, and birthing people in Atlanta's Fulton County have positive outcomes before, during, and after pregnancy. These standard indicators honestly will be measured across all 9 collective impact sites: maternal mortality, severe maternal morbidity, preterm birth, and infant mortality. And then the strategies and solutions that we agreed upon here in Atlanta are that we're going to dismantle racism. So I always joke around and say, when we dismantle racism, of course, we're going to win the Nobel Peace Prize. We're going to increase access to equitable and affordable care. And we're also going to use a community education and community engagement approach. And then underneath those 3 strategies, we have anywhere from 1 to 3 solutions. And so particularly in our increased access to equitable and affordable care, you see that we have a solution that focuses on doulas. And so I'm going to talk about that a little bit, and then also talk about some of the other awesome doula efforts here in Georgia. And so the March of Dimes Collective Impact Initiative here in Atlanta, the main 2 ways that we would like to increase access to doula care is we want to provide funding for a pilot group of Black women to be trained as doulas. And we also want to provide funding for a pilot group of Black women to pay for a doula during their birthing journey. And essentially, we feel that improving access to equitable and culturally informed maternity care via doulas can support women within their communities and lower costs and reduce unnecessary medical interventions. We are looking for funding for both of these initiatives, both to train a cohort of doulas and provide doula services to women. So I wanted to transition a little bit and talk to you about 3 organizations here in Georgia that have ongoing doula efforts. I've been doing great. I feel a cough coming on, so excuse me, I'm just going to go ahead and get it out. But I did want to highlight these organizations. They are involved with our March of Dimes Collaborative, and they're really just great organizations to know here in Georgia. So the first one is the Center for Black Women's Wellness. I call them the little engine that could. They have been based in the Mechanicsville community in Atlanta, Georgia for 35 years. They're a community-based family service center that's committed to improving the health and well-being of underserved Black women and their families, particularly in terms of maternal and child health. They support and connect and also uplift Black women by strengthening their communities, building healthier communities, and connecting them to the resources that they need. They have a funded Atlanta Healthy Start Initiative program, which is federally funded, and it provides support to moms-to-be during pregnancy and also in the postpartum phase. And the goal is to keep babies healthy and thriving in a safe, supportive, and nurturing environment. As part of that Atlanta Healthy Start Initiative, it's a home-based education curriculum that includes a team of wonderful people, including nurses, family support specialists, and mental health providers. And annually, they serve about 700 pregnant and postpartum women infants and also dads. They also have a dad and partner initiative, which I think is really important, right? Sometimes we don't focus on the dads and the partners as much as we should. And so their case management services through this program, it includes home visits, parent and health education, breastfeeding education and support, mental and emotional support, their monthly peer groups, their various linkages to health and social services, such as housing, workforce development, and also postpartum education. So in terms of specifically doula efforts, so the Center for Black Women's Wellness, CBWW, they partnered with the Atlanta Doula Collective, which I will talk about them next, to provide a doula free of charge to 20 of their Atlanta Healthy Start Initiative moms. And so basically the way the partnership worked is the Atlanta Healthy Start Initiative moms within the Center for Black Women's Wellness would indicate their interest in having a doula during their pregnancy journey. And with the assistance of the case manager, they began the process of selecting a doula. And so the Atlanta Doula Collective, they would actually provide the doula support services to the mom and her family. And that included 2 prenatal visits, which the first one really focusing on what is that mom's birth plan, also providing support obviously during the actual birth, and then 2 postpartum visits focusing on breastfeeding education, and also having a postpartum plan. And this program was grant funded. So I also want to talk about the Atlanta Doula Collective. So the Atlanta Doula Collective is another mighty organization. It's a small nonprofit organization that is actually a collective. It's a team of Black women who are serving as labor and postpartum doulas within the Atlanta metro area. And their main purpose is to bridge the gap in Black maternal health care by providing affordable labor support options for Black families. They also provide reduced rate perinatal services, and they also provide a lot of free community programming. And so they would like to uplift and empower Black mothers and their families, and they want to shift the paradigm of Black maternal health outcomes to attain Black birth liberation. And so again, a lot of free community education programming that if you are pregnant in the Atlanta area, you're welcome to attain. But really, I think more importantly, what they're doing is they're talking about doulas, raising the consciousness of doulas within the community, particularly within the Black birthing community, and offering it as an affordable option, right? Because they have essentially a sliding fee scale that you're able to work with them, that if you are interested in securing a doula, because unfortunately, and we'll talk about this a little bit more, doulas are not covered by insurance in Georgia, not covered by Medicaid. So essentially, someone wants a doula here in Georgia, people have to pay out of pocket. So the Atlanta Doula Collective, in my opinion, is doing a great service being able to offer this service to communities that may not be able to afford it. Another great organization is Healthy Mothers, Healthy Babies Coalition of Georgia. They are a 50+ year organization who their main purpose is to improve access to prenatal and preventative health care for women, children, and families in Georgia. They do this through direct service, advocacy, and community education. And in terms of doula efforts, so they have a Building Perinatal Support Professionals program where they provide scholarships and support to train as a certified doula, childbirth educator, or certified breastfeeding specialist. The ladies who are going through this program to become trained as, let's just use a doula as an example, they're partnered with a mentor. They also receive great information about business development support, right? It's one thing to learn about how to support women, be a doula, be an advocate, but at the end of the day, as a doula, you're an entrepreneur. So what does that mean, right? Like, how do I have a doula business, a doula practice? So I think that's a really important part of the conversation. And then they have many continuing education classes on a variety of topics, but in particular, including birthing justice and implicit bias. So at the end of 2022, I believe it was, Healthy Mothers, Healthy Babies had a doula Medicaid reimbursement pilot where they partnered with several care management organizations here in the state. And their main premise, they were trying to explore the outcomes of moms, birth givers, and babies participating in Georgia Medicaid. And so essentially, through this program, they were able to provide 175 clients, 175 birthing people throughout Georgia with a doula free of charge. And that doula was reimbursed through the partnership with the care management organization. And so the whole point is to explore the best process for reimbursing doulas to promote their economic security and retention here in the Georgia healthcare workforce. And they have some preliminary results from their pilot. Before I get to that though, so the clients who received the doula in the pilot, they also received 2 prenatal visits. Again, one of them focusing on the birth plan creation. They received obviously labor and delivery support, and then they also received 2 postpartum visits. And so some of the preliminary findings from this pilot were that 80% of the babies born to birth givers in the pilot were born at a normal birth weight. 80% of the babies received some form of milk. And in terms of the APGAR scores, they were averaging 7.2 at 1 minute and 8.5 at 5 minutes. And so, excuse me, the whole premise of this pilot is to encourage the legislator to adopt legislation to cover full spectrum doula services during the prenatal and postpartum period through Medicaid. This slide is a little hard to read, and I'll just go over it very briefly. But when you receive the copy of the slides, really the main thing I wanted you all to see is that there are a number of efforts throughout the country where basically folks are realizing the importance of doulas and trying to figure out how can doulas be reimbursed, particularly via Medicaid, because particularly here in Georgia, Medicaid covers, I believe it's over 50% of the births. So that's really going to be an important vehicle when and if we get this right of being able to reimburse doulas. So you can just see the variety of the states who are either actively reimbursing doula services on a Medicaid plan, states are in the process of implementing Medicaid doula benefits, and states that have, proposed action, but there's no progress. And unfortunately, we see that Georgia is not here in this list. In 2021, there was a Medicaid benefit for doula services bill, but unfortunately it failed to pass out of the Senate. And so things have been a little quiet on the doula front in terms of legislation, particularly this year, 2024. I don't think there was any specific doula legislation. So it's my hope that this is picked up again, and that really ultimately, I believe, and this is my personal opinion, that doula is covered throughout all forms of insurance, Medicaid, but also private insurance. But unfortunately, we're not here, there, and doula yet. We're not here in Georgia, there yet. I did want to mention briefly, shameless plug, as I mentioned, I am part of a doula agency here in Atlanta Family Doulas. We provide, it is private, and so folks, again, have to pay out of pocket. We provide pregnancy, birth, and postpartum support in a compassionate and culturally relevant manner. It is actually one of the premier Black-owned and majority Black staff doula agencies here in Atlanta. We provide childbirth education, labor doula support, postpartum doula support, and placenta encapsulation. I had a brief video from the founder and owner of Atlanta Family Doulas. I think I'll skip that because I know we're coming down on time. But again, when I send this all to you all, you'll be able to click on it just to hear about, our comprehensive approach to providing support to families. And then finally, I want to start to end with who needs a doula. And honestly, I think everyone needs a doula. And you can see this is actually just a smattering of my clients. But you'll see that, it's racially, ethnically diverse. My very first client, so they will always have a special place in my heart. They were actually virtual in July 2021. They were based in Florida, so that's Jason. Renier, his mom was a single mom, honestly, and that's not my business, not my place. Didn't really know what was going on with her partner, but her partner was not able to be at the birth. She contracted with us probably like a month and a half before her birth and was like, she needs support, at her birth. And so we were there, supported her. Renee was born January 2022. Baby Z was born last year, January 2023. I just went to her first birthday last month. It was so cute. She had a Wakanda 1-year-old party. But yeah, so you can see again the diversity, and everyone needs a doula. I know that we've talked about the ethnic and racial disparities, and I do think that doulas really can be a solution for Black and brown women, but it's for all women. Henry last year, February, his parents, they were white Caucasian professionals, but they were older, had tried several times to have a child, and just felt that they need an additional level of support. So I think anyone can benefit from a doula, and I hope that we get to a place in our state where we're able to provide that for everyone. So I know this is a lot of information, and sometimes when you get a lot of information, it can be overwhelming, and it's like, okay, well, what can I do? What can I do for my place, right? And so I think these are 4 very simple steps of things that you can do. So you can volunteer with organizations that are lifting up the maternal and infant health crisis. Of course, I'm going to tell you to volunteer with March of Dimes, but there are many other wonderful organizations, several that were mentioned in this presentation, that you can volunteer with. Advocate, right? Our legislative session is still going on right now. There are various maternal and child health policies. Advocate for those policies that can impact and make a change in our maternal and child health outcomes. Spread awareness. I think a lot of times that particularly us in the maternal and child health field, we think everyone is talking about this. Everyone isn't. So you can be a part of the conversation, sharing what you learn, spreading awareness, right? And then of course, donating. All these nonprofit organizations, you know, they need resources to continue to do what they need to do to improve the health of moms and babies. Lastly, you want to also, and this is, you know, just a small section, honestly, subsection of Black women that we've lost, but we have to, you know, we have to say their names. We have to remember those that we lost. Kara Dixon Johnson, she's probably, honestly, one of the most famous, lost her life in 2016 in California. Her husband, Charles Johnson, is actually Judge Hatch's son, and he has become an advocate for maternal and child health and the fact that no husband and no woman should lose their life giving birth. Candace Shanice Wallace, she was actually a pediatric resident and lost her life giving birth. Dr. Shalon Irving, many people also heard her name as well. She was a CDC epidemiologist. So I think also something from this, which we didn't really talk about, but it is implied, unfortunately for Black women, our level of education, our level of income, it's not protecting us, right, from dying during childbirth. You hear of these women, they're accomplished women, doctors, PhD, and they still lost their life during the birthing journey. And that just shouldn't happen here in America. So in conclusion, I would like us to name and identify what is contributing to the maternal health disparities, particularly the Black maternal mortality crisis. I want us all to listen to Black women. I want us to work with Black female-led organizations to develop solutions for your specific community. I want us all to commit to anti-racist strategies to achieve health equity. I want us to expand the birth worker labor force to include Black midwives and doulas as trusted sources of care. And I also want us to celebrate the joys of Black motherhood and the birthing journey. I know for me, particularly doing this work, it's a balance, right? Again, the stats are there and they can be dire, but there is joy. There's joy in birthing, there's joy in motherhood, there's joy in Black motherhood and Black birthing, and we have to find the balance of how to celebrate that as well. This is a list of resources which you all will have access to. My contact information, both March and Dimes and my consulting. And then lastly, I always like to end with this slide because at the end of the day, right, again, the stats, the numbers are important, but those stats and those numbers are people. And so for me, this issue is very personal. I am a racialized Black woman moving through the world, experiencing racism, microaggressions every day, but also doing my best to make this world a better place. And my son, my first born, my 11-year-old Du Bois, he was born, at this point, I don't even remember. He was late preterm. He was either 35 or 36 weeks, so he was just on the cusp. He was a teeny tiny thing, 3 pounds, 3 ounces. And midway through my pregnancy, I was diagnosed with a condition called intrauterine growth restriction. Still to this day, 11 and a half years later, all I can tell you about that is they said my placenta wasn't working correctly. And again, I'm the SAP, right? MPH from Emory University, married, but still have this condition, not really explained to me well. And so I was told Du Bois probably wouldn't make it full term. But we were never in a situation where, you know, it was dire that Du Bois, we knew Du Bois would come home. It was never like he's not going to make it. But he did spend about 5 days in the NICU and then 3.5 weeks in the intermediate nursery, essentially learning how to eat. So he was in the hospital for a month. So I do this work for Du Bois. Those are pictures of him and his sister. He is 11 and a half now, going on 40. He thinks he's smarter than everybody in the house, and he's perfect in all ways. A small guy, a little smaller than his 9-year-old sister, but she is really kind, and she's the artist in the family. And still to this day, when she draws our picture, she draws him taller than her because she knows that it's a sensitive topic for him. So thank you all so much. I hope this was informative. Excuse my grody voice today, but we made it through with just one cough. Thank you.
Thank you so much for your insightful presentation. So uplifting, even in spite of some of the of the statistics. We do have some time for Q&A, so if you would like to speak, please either turn your camera on and unmute yourself or raise your hand and I can recognize you either which way. Dr. Smallwood, please.
Greetings. First of all, thank you so much for a very insightful presentation that brings together both kind of the academic and the data as well as the humanity of this. I really appreciate the way that you wove those together. And as I mentioned in my comment in the chat, thank you for also lifting up the story of Dr. Shalon Irving. As I mentioned, I use the NPR Code Switch podcast about her, that she's featured in, talking about this racism is killing me inside, around weathering and Black maternal mortality and all that. So I really appreciate you doing that. My question is around the work that March of Dimes in Georgia is doing in terms of being able to, like, a lot of what you talked about was narrative and uplifting narratives and even counter narratives that don't always get told in these stories. And so I'm wondering what kinds of efforts are being specifically done, not just to provide like the access to the resources, but also to elevate the stories and the experiences of particularly Black birthing people in Georgia.
Yeah, that's a great question. And I'm all about narrative these days. So I'm going to get back to that, but I also want to mention something else. So one of our other solutions is a guaranteed basic income program, very heavily modeled after Dr. Zaya Mawala in California, where she was the first program to provide in California's Black birthing and Indigenous people with a basic income, a stipend for a year, right, for them to do what they need to do. And so we're trying to do that work here in Georgia as well. And part of that work is narrative change, right? Because a lot of times with those programs, which is very understandable, the two main comments are, okay, you're going to provide this stipend to Black birthing people, but what happens, you know, when the money runs out? And then also, why an organization like you, March of Dimes, why are you in this space, right? And so just that whole conversation of narrative, I've just really been in that space very recently. But back to Black birthing people. So another one of our solutions, also the March of Dimes Atlanta Collective Impact Initiative. And there is a lot of great work going on in Georgia around narratives. So Morehouse School of Medicine, they have a Center for Maternal Health Equity, which is led by Dr. Natalie Hernandez-Green. And they have been doing essentially a near-miss maternal mortality study. And so they're collecting stories, qualitative stories of Black and Brown birthing people throughout the state who, thankfully, they did not die. They're still here. They're telling their stories. And so we can learn from them, right? So there's that work going on. There's also the CDC has their Hear Her campaign, which has been going on for a while. And so for us, with the March of Dimes Atlanta Collective Initiative, we do think stories and narratives are important. And we also want to be in that space, but we also don't want to duplicate efforts, right? And so we're talking about, it's called different things we're still figuring out, but either a maternal monologue series, a sisterhood circle, and a lot of our conversations have been around. So we gather these stories, which there are being gathered in different ways here throughout the state, but then what are we going to do with them? So, you know, what's the product? Are we having town hall conversations, community conversations? Is it a podcast? Is it conversations with hospitals? And so we feel like that's where our niche can be, and we're still figuring it out. We're still talking, but that's where we are with the narrative piece. But absolutely agree with you that the stories of Black women, and not all of them are negative, right? But they're important. I mean, that's part of, in the conclusions, what I said, we have to listen to Black women. We have to hear their stories. We have to uplift their stories to impact this crisis.
Absolutely. And I appreciate that. I would love to just be in contact with you back channel to follow up on some of those things, because some of those efforts are going on even, you know, in this region. And I would love to be able to connect you with some of the work that's being done around here, around that very thing. So thank you so much.
Yes, thank you. I put my email in the chat.
We do have another question, Alexis.
Hello. First,
Hi.
I want to thank you for the presentation. One question I had, you mentioned talking to hospitals in our clinics. Have you received, what type of feedback have you received regarding the initiatives? The stats are there, we know the stats, but I know a lot of times when addressing just provider bias or even care, different quality of care being given to brown people and people of color, a lot of times on the clinical side, physicians are not receptive. So I'm wondering what type of feedback you've kind of received, whether that be positive or negative regarding different initiatives.
Yeah, I think that's a great question. So March of Dimes, remember I mentioned our three-pronged approach, and one of them is direct service and direct education. And so one of our, I guess you could call it education training modules, is an implicit bias. Now, I will be the first person to tell you that implicit bias is not the be all to the end all, right? But I do think it's an important conversation for us to have, and an important conversation to have in hospitals in particular. And so our implicit bias trainings, within the past, I'd say like 3 to 5 years, we've trained over 30,000 providers throughout the country. And from that training, we've also basically, we're now at like a 2.0 version. And so the first version, I think, was very much, this is implicit bias. We all have implicit bias. As a provider, recognizing your implicit bias and then coming up with a plan. And that's really the 2.0 version. So not just you as a single provider, but what can your health system, how together can we come up with a plan to address implicit bias so that we treat all of our patients, right, the way that they need to be treated. So that's one way. March of Dimes is definitely in that conversation. There's some other really great organizations as well who are, are in that space, in that conversation. But I think for me, one of the main things that I've learned doing this work, collective impact, right? At the end of the day, this is about systems change, and it takes time to change systems. And we also have to have different strategies and levers to pull to change our systems, right? So an implicit bias training is one, but we also have to be over here, right, in the advocacy space. So even when we're talking about doulas, right? Like eventually I would love for us to have legislation around reimbursing doulas. So a little all over the place in terms of the response to your question, but I think just for all of us, we have to think about the different levers that we can pull and where are we, right, in this system of lever pulling. And so for some of us, yes, we're in the space of we're talking to providers, we're in the hospitals, but for others of us, what space are we in and what levers can we pull collectively?
Thank you so much. I actually just officially launched my doctoral research, and I have questions about like birthing experience and whether individuals use doulas, and I have some wonderful doulas that have agreed to partner and distribute the survey. So I will definitely be in contact. Just learn, like you said, emphasizing the birthing experience, but also getting to know like whether like doulas we know are helping, but getting that data also is important to show like why it should be reimbursed and different things like that. So I will definitely be in contact with you.
Absolutely. I look forward to hearing from you.
Thank you. We are up against the time, but there is
okay.
one more question if Tamara doesn't mind answering.
I'm fine. You sure?
Okay. Tamaya?
Yes. So my question is just kind of piggybacking off of Alexis, but more so like with the patients and everything and in the community with people talking about maternal mortality and kind of doulas being a topic more so in public discourse. Do you feel like there's been a change in kind of how doulas are perceived? Are people more aware of them? Are they more likely to use them? Kind of what's been your experience with that?
Yeah, that's another great question. I do feel like the consciousness of doulas is definitely raised within the community, which I think that's an important first step. I still think, that's fine, and that's why we had to continue to have these conversations. I still think there is confusion around, essentially like what's the difference between a doula and say like a midwife, a certified nurse midwife. I do also think, which again is understandable because we don't have reimbursement policies in place. I think there is the perception that a doula is not affordable, right, for the common average person. And so that's why I'm really thankful and appreciative of the Atlanta Doula Collective, that they're doing this work in the community. So I think that's another myth that we have to dispel, for lack of a better word. And I think also in community, we have to get creative, right? So, folks, when they're having babies, have registries, have the Babies R Us registry, the Toys R Us registry. You can have, the cash registry for people to contribute towards you getting a doula if you feel that's important. So I think that's another piece of the conversation that we also need to have in our community, because I personally feel like solutions are already in the community and conversations have to happen in the community. I think the final piece is, which again, this is part of the system change, just being honest and transparent. Some hospitals are much more friendly to doulas than other hospitals are. Like that culture has to change within hospitals. All hospitals have to start to view doulas as part of the healthcare team, and being transparent that every single hospital doesn't necessarily feel that way. So that's another part of the community conversation. I think that has to happen, and system change that has to happen, which will take time. But if we keep pressing our hospitals, right, like we can push them a little faster. One quick thing I wanted to mention, and it is in the resources, but just as we talk about community and grassroots efforts. So Kimberly Seals Allers is a Black woman who founded an app called the Earth app, IRTH, an amazing app. To me, I liken it to basically a digital green book. We all know about the green book from the 1920s and 1930s, where Black folks had a physical book as they were traveling through the South, which would tell them which places were safe for them to eat, to stop. To me, the Earth app is like that. It is a digital green book for Black and brown folks to, direct our counterparts, our community partners of places to go that treat them with respect in terms of birthing. So please check that out. I'll drop the link in the chat as well, and it will be in my resources. But I think that's a great app as a doula. I recommend it to all my clients. But again, that's just another conversation we can be having in the community, about what we as community members can do.
So, Dr. Chopak? Yeah, just one last thing. So thank you, everyone. Thank you, Dr. Chopak, for hosting the Q&A, and everyone who attended. And Ms. Mason, truly appreciate this. And you can tell by the large number of people who showed up, of interest. And we are truly grateful for you doing this. So on a history note, the Green Book, I'm glad you brought it up. Lots of people don't know about it. Us who are a little bit in the, gray hair part, we know about it, because we've had to use it. So if ever, there is an opportunity for you or any of your colleagues to talk about it and educate us on this one, particularly, given the significance of the book itself, particularly in this day and time, it will be great to have that talk. So, but anyway, great. Thank you for that. And also thank you for your time and your effort. And from our office, I don't know if Dr. Chopak, you want to say anything, because, okay. All right, then. Well, thanks, everyone. Thank you for staying the little extra time. And we truly appreciate this. And we will see you at our next seminar in a couple of weeks. So thank you very much, and have a great and wonderful rest of the week.
Thank you, and happy Black History Month.
Absolutely.
Yes.
Thank you.
Thank you, Tamara.